leather circulation. You already know that leather circulation consists of which vessels? Pulmonary trunk, which start from what? From which chamber? From right ventricle, subdivides into two pulmonary arteries. They conduct deoxygenated blood to lungs. In lungs, exchange of gases, and oxygenated blood from lungs through what? 4 pulmonary veins goes to left atrium. That is leather or pulmonary circulation. And then greater or systemic circulation, and you will prepare aorta, branches of aortic arch, and only external carotid artery. External. Internal not necessary. External carotid artery. You already know that aorta consists of ascendens part, and ascendens part start with bulbous aorta, and from bulbous aorta we have what? Right and left coronary arteries. Then aortic arch, arcus aorta, and descendens aorta, and descendens aorta consists of thoracic and abdominal part. Today we speak only about aortic arch. From arcus aorta start 3 large vessels. First is brachiocephalic trunk, and brachiocephalic trunk subdivides into right common carotid and right subclavian artery, and from aortic arch also start left common carotid and left subclavian. Brachiocephalic trunk, left common carotid, and left subclavian artery. Then we speak about common carotid, and common carotid subdivides into internal and external carotid artery. And you will prepare only external carotid. External carotid artery has 3 groups of branches: anterior, posterior, and middle. Anterior group. From the beginning, it gives superior thyroid artery, arteria thyroidea superior. Superior thyroid artery, arteria thyroidea superior. And it gives superior laryngeal artery, arteria laryngea superior, goes to larynx and supplies larynx above of vocal ligaments. Then, lingual artery, arteria lingualis, it goes to tongue and subdivides into dorsal artery of the tongue, arteria dorsalis lingua, and deep artery of the tongue, arteria profunda lingua. And lingual artery on the way to tongue passes through Pyragoff's or lingual triangle. It is good if you repeat walls of lingual triangle. Maybe somebody know today. Remember walls of lingual triangle. Please. Superior wall, that is hypoglossal nerve. Anterior wall, that is posterior body of mylohyoid muscle. And posterior wall, venter posterior of digastric muscle, musculus digastricus. And last artery in anterior group, that is facial artery, arteria facialis. Facial artery goes to face, supplies muscles of facial expression, and gives branch to the angle of eye, that is arteria angularis. And here it makes anastomosis with branch from internal carotid artery, that is ophthalmic artery. It gives arteria dorsalis nasia, and arteria dorsalis nasia anastomosis with arteria angularis. Next time, when you will prepare internal carotid, we discuss this anastomosis. Today only arteria angularis. Once again, 3 anterior arteries: superior thyroid, lingual, and facial. 3 posterior arteries: arteria accipitalis goes to occipital region, arteria auricularis posterior, and arteria sternocleidomastoidea goes to the same muscle. and 3 middle arteries. 2 of them are terminal branches of external carotid, and 1 artery starts from external carotid in the beginning and passes in space between internal and external. This is ascendens pharyngeal artery, arteria pharyngeal ascendens, supplies pharynx, auditive tube, and meninges of brain in posterior cranial fossa. And these 2 terminal branches are arteria temporalis superficialis, superficial temporal artery passes in front of external acoustic meatus and gives parietal branch and frontal branch. And last, that is arteria maxillaris, maxillary artery, arteria maxillaris. Arteria maxillaris has 3 departments. First, that is behind the neck of the mandible. If it is mandible, that is mandible. This is mandible. First department, that is behind the neck of the mandible. Next, it goes into fossa infratemporalis and then continues into pterygopalatine fossa. 3 departments in maxillary artery. First, behind the neck of the mandible. Second, in fossa infratemporalis. And third, in pterygopalatine fossa. In first department, arteria maxillaris gives arteria alveolaris inferior. It supplies mandible, teeth, gingiva, gum. Then another branch, rami tympanice. Rami tympanice goes to temporomandibular joint and supplies it. And arteria meningeae media, middle meningeal artery, arteria meningeae media. It goes into the skull through foramen spinosum and supplies meninges in middle cranial fossa. That is in first department. In second department, it gives arteria masseterica, goes to the same muscle. Arteria buccalis, it supplies buccinator muscle and mucous membrane of the cheek. And it gives arteria alveolaris superior posterior, goes to posterior teeth of the maxilla and supplies them. Arteria alveolaris, superior, posterior. And last, in third department, it gives arteria infraorbitalis, infraorbital artery. It passes through canalis infraorbitalis, and when it leaves canal, it makes anastomosis with branches of facial artery. The same, it gives arteria alveolaris superior anterior, for anterior teeth of maxilla, and arteria sphenopalatine. Arteria sphenopalatine passes through the same opening, through foramen sphenopalatinem into nasal cavity, and supplies lateral wall on posterior side of nasal cavity, arteria nasalis posterior lateralis. And last, arteria palatina descendens palatine artery, which goes to hard and soft palate and supplies them. My diagram only for your understanding, clear? You need to know names of these arteries and their branches. What we can see, common carotid artery, external and internal carotid. From external carotid arteries. First is, okay, that is, it is larynx, that is thyroid gland, and this is superior thyroid artery, arteria thyroidea superior, and it also gives arteria laryngea superior. That is first artery, first branch. Then arteria lingualis, lingual artery. It passes through Pyragoff's triangle and goes to tongue. And facial artery, arteria facialis. Only beginning of facial artery we can see here. This is facial artery. Posterior branches. here, arteria accipitalis, goes to occipital region. And other branches here it is impossible to see. Only, I think here, this is ascendens pharyngeal artery, arteria pharyngea ascendens. It passes in space between internal and external carotid artery and supplies pharynx. That is all. In preparatory, that is all.